Why do we put this thing over here where I have to cross it? Excuse me, just. Okay, so everybody's here. Thank you, Mike. Is she seated? The Committee on Insurance and Financial Services shall come to order. Mr. Clerk, will you please call the roll to establish a quorum?
Chair Carter,
Present.
Representative Steckloff. Here. Green.
Present.
Rogers.
Here.
Scott.
Present.
Young.
Here.
Fitzgerald. Here. Grant.
Here.
Hoskins. Here. Snugglue. Saraglu.
Oh, here. Couldn't hear you, sorry.
Harris.
Here.
Markkinen. Here. Bazat. Aragona. Bruck.
Present.
Nair.
Here.
Smith.
Present.
Madam Chair, you have 15 members present and quorum.
Thank you. Now we need a motion to adopt the minutes from January 18th, 2024 as printed. Rep. Breen moves to adopt the minutes as printed. Hearing no objections, the minutes are adopted as printed. First on our agenda are House Bills 4944 and 4963, which we heard testimony on October 19th. Before everyone is Substitute H2 for House Bill 4944 and Substitute H3 for House Bill 4963. Here to explain the substitutes is Josh Stump, Legislative Director for Representative Dale Zorn, the bill sponsor of House Bill 4944. Representative Samantha Steckloff introduced House Bill 4963. Joining Mr. Stump is Sidney Kraisman, Chair of the Advocacy Committee and Summer Camp Program of Michigan Alexander Graham Bell Association for the Deaf and Hard Hearing. Tressa Sanders, Corporate Director of Human Resources at a large healthcare company and mother of children with hearing loss, and KT Magviglia, did I do that? Thank you. Morgan, lead member of the Legislative Committee of Michigan Coalition for Deaf, Hard of Hearing, and Deaf-Blind People. In the event, members need additional policy-specific questions. Josh Stump, Sidney Kraisman, Tressa Sanders, and KT Magviglia Morgan are here to explain substitutions. You may now come forward. You may start when ready.
Thank you. Good afternoon. Madam Chair, fellow committee members, thank you for allowing me to speak. My name is Josh Stump. I'm the Legislative Director for Representative Dale Zorn. I'm here to speak on the changes that have been made to Representative Zorn's House Bill 4944 and Representative Steckloff's House Bill 4963. After conversations with Blue Cross Blue Shield and Michigan Association of Health Plans, a handful of changes have been made. These were minor technical changes and do not change the intent of the bill. In both bills, we struck deductible and coinsurance and inserted applicable cost sharing, including deductible, coinsurance, or copay. In both bills, we delayed the implementation date to January 1st, 2026 to help insurance providers prepare for the change. Both bills are now in compliance with federal regulations regarding IRS guidelines for high deductible health plans. We added standard language that has been used in many other states to cap cost sharing on services while carving out qualified high deductible health plans to ensure that those with high deductible health plans are not violating federal law or paying a big tax bill after the fact. We added language to adjust for inflation with the medical care component of the United States Consumer Price Index. And there was one change that did not come from the insurance industry, and that was language that requires an ear, nose, and throat specialist to be seen in the process. This is standard practice, but we wanted it explicitly in the bill. These were the changes that have been made, and I thank you for your time. If you have any questions, we're open to that.
Representative Rogers.
Thank you, Chair. Can you repeat that? You just said that an ear, nose, and throat specialist. That is not my understanding. I thought it was like an audiologist, and I thought originally there was physician language in there.
Yes, if you guys want to take that one.
So it's standard practice to see an audiologist. And once they determine, okay, you have hearing loss, you'll go to an ear, nose, and throat specialist, and then you'll go back to the audiologist.
Thank you.
Are there any other questions? Minority Vice Chair Harris.
Thank you, Madam Chair. Thank you, folks, for being here. I appreciate this, but I do have a couple questions. One is, in the ACA, there's a discriminatory clause, and this does have an age range. Would that, in fact, trip that ACA discriminatory clause and cause this to now to be covered across the entire gambit of age range?
Yeah, so we worked with LSB and our attorneys. They do not believe that it would trigger that. They believe that it's an exemption. There are about 25 to 28 other states that have passed similar legislation. All of them have age restrictions. None of them have triggered this. So no, that is not our understanding according to LSB and LSB research and our writers.
Thank you. Madam Chair, I have a follow-up, if that's okay.
Yes, it is.
Thank you. I think there's also another section of ACA that deals with state mandates and who actually covers the fees on that. So if my understanding is that if a state mandates some type of coverage like that, the state is actually responsible for the fees.
There is no current mandate. It follows the same suit as autism bill coverage.
Okay.
So there would be nothing.
I appreciate that. Thank you.
Representative Bruck.
Thank you, Chair. I believe my question was just answered to Rep. Harris. Thank you.
Thank you. Are there any additional questions? Okay, well, now I will need a motion to adopt the substitute for H2 for 4944. Rep. Breen moves to adopt the substitute. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representatives McFall,
Yes.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Hoskins,
Yes.
Cerniglu,
Yes.
Harris,
Pass.
Bazat, Markkinen,
Pass.
Bazat, Aragona, Bruck,
Yay.
Mayor,
Pass.
Smith.
Pass.
Madam Chair, you have 11 yeas, 0 nays, 4 pass.
The substitute is adopted. I'll now read in the cards. Not wishing to speak and support the bill, Dr. Casey Stotch, Michigan Audiology Commission. Not wishing to speak and also supports the bill is Don Kettinger of the Michigan Nurses Association. Not wishing to speak and oppose the bill, Scott Kempa, Michigan Association of Health Plans. Not wishing to speak and oppose the bill, Leah Robinson, Michigan Chamber of Commerce. Okay. Now we need a motion to report House Bill 4944 as substitute H2 with recommendation. Rep. Young moves to report it. Mr. Clerk, can you please call the roll?
Chair Carter,
Yes.
Representatives McFall,
Yes.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Hoskins,
Yes.
Cerniglu,
Yes.
Harris,
Pass.
Markkinen,
Pass.
Bazat, Aragona, Bruck,
Yay.
Nair,
Pass.
Smith.
Pass.
Madam Chair, you have 11 yeas, 0 nays, 4 pass.
Thank you. Oh, let me move this. Lost my place. Okay, thank you. House Bill 4944 is reported with recommendation as substitute H2. Now we need a motion to adopt substitute H3 for House Bill 4963. Rep. Fitzgerald moves to adopt the substitute. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Hoskins,
Yes.
Cerniglu,
Yes.
Harris,
Pass.
Markkinen,
Pass.
Bazat, Aragona,
Pass.
Bruck,
Yay.
Nair,
Pass.
Smith.
Pass.
Madam Chair, you have 11 yeas, 0 nays, 5 pass.
Thank you. The substitute is adopted. I'm reading in the same cards. Dr. Casey Stouch, Michigan Audiology, not wishing to speak, supports the bill. Don Kettinger from the Michigan Nurses Association, not wishing to speak, supports the bill. Scott Kempa, Michigan Association of Health Plans, not wishing to speak, opposes the bill. And Leah Robinson, not wishing to speak, from the Michigan Chamber of Commerce, opposing the bill. Thank you. We need a motion to report House Bill 4963 as substitute H3 with recommendation. Rep. Scott moves to report House Bill 4963 as substitute H3 with recommendation. Can you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Hoskins,
Yes.
Cerniglu,
Yes.
Harris,
Pass.
Markkinen,
Pass.
Bazat, Aragona,
Pass.
Bruck,
Yay.
Nair,
Pass.
Smith.
Pass.
Madam Chair, you have 11 yeas, 0 nays, 5 pass.
Thank you. House Bill 4963 is reported with recommendation as substitute H3. Next on the agenda is testimony only on House Bill 4015. Here to explain the bill is the bill sponsor, Representative Jennifer Conlin, and joining us virtually. Huh? See? Oh, he's not? Oh, where is he? Is he here? Representative Jennifer Conlin, if you could please come forward. And I'd like to thank everyone who spoke previously. Thank you so much for your time. Thank you for coming. Okay. Thank you, Representative Conlin. The floor is yours.
Thank you, Chairwoman Carter and members of the committee for allowing me to testify this afternoon to House Bill 4015. As we all know, prescription drug affordability is a huge issue to tackle nationwide. With respect to insulin specifically, there are many diabetics across our state and around the nation who are simply unable to afford their medication. We hear stories all the time of our residents having to ration insulin or illegally sell leftover doses to those who are otherwise unable to purchase from a pharmacy. While changes are being made at the federal level to address these challenges, there is still much to be done statewide that can help diabetic Michiganders. You will notice that my legislation currently caps the copay of insulin at $50, although I am working with stakeholders to better align costs federally and stateside. I'd like to thank Blue Cross Blue Shield of Michigan and the Michigan Association of Health Plans for continuing to partner with me to come up with a better product for everyone. Quite simply, my legislation creates a rate which is far more reasonable than $375 to $1,000 per month for many diabetics. Critics may first argue that this legislation will only help a select portion of the population. While this is true, thousands of Michigan diabetics will still benefit from the copay cap. This is progress and means that patient adherence to their medications will increase overall, providing healthier outcomes within our state. Others will argue that a copay cap will only force an increase in monthly premiums. An insulin copay cap is just a first step in solving the problem while we still look for innovative ways to encourage in-state manufacturing of insulin or seek to hold drug companies accountable for price gouging. I'd like to add that in our state of Michigan, according to the CDC, 12.2% of the adult population have diabetes, and every year another 60,000 individuals are diagnosed with diabetes. With that, I will turn it over to Gary Doherty with the American Diabetes Association.
I'm understanding he's on Zoom now. Ms. Doherty, you can begin.
Thank you. Chair Carter, members of the committee, my name is Gary Doherty, and I'm the Director of State Government Affairs for the American Diabetes Association. I shared my written testimony with the committee clerk yesterday, so I hope you have that in front of you, and I encourage you to read it. But in the interest of time, I will focus my comments briefly on the need for this legislation and to address arguments you're likely to hear from the opposition. First of all, I want to thank Representative Conlin for introducing House Bill 4015 and to share ADA's support for this effort to limit patient cost sharing for insulin. People with diabetes are facing a crisis. Insulin prices have increased dramatically over the last 2 decades for a medicine that's more than 100 years old. However, the formula for insulin has not substantially changed since the 1990s. When you consider that all people with type 1 diabetes and historically 30% or more people with type 2 diabetes use insulin, it's easy to understand that without insulin, these people will die. And people shouldn't die because they can't afford to live. House Bill 4015 would help people in state-regulated health plans by capping the cost they are paying for their insulin at $50 per 30-day supply. Our hope is that the cost-sharing limit would be reduced to $35 to be in line with Medicare and what many other states have already done, and that the cost-sharing limit would be exempted from the patient's deductible, making it even more affordable. Today, 25 states plus the District of Columbia have enacted some form of limitation on patient cost sharing for insulin. Well over half of those have limits set at $35 or lower. Continued momentum at the state level can only help to further motivate Congress to pass pending bipartisan legislation to establish a $35 copay cap on insulin in commercial insurance plans, benefiting even more Americans. I don't often mention concerns expressed by opponents as part of my proponent testimony, but in this case, I think it's important to debunk some of the concerns that are likely to be shared with you. You may hear that House Bill 4015 will only benefit certain Michiganders, those on state-regulated health plans, and that it will not benefit those in employer-sponsored and other commercial health plans. This is true. As state legislators, you can only regulate those plans over which you have jurisdiction. You may also hear that this legislation doesn't actually do anything to lower the cost of insulin to the system. The price of insulin is outrageously high. The insulin supply chain is complex, opaque, and has proven to be a challenge for Congress to unravel in order to fully address the pricing issue. Whereas House Bill 4015 doesn't lower the price of insulin, it does make it more affordable for people who rely on insulin to live. And finally, you may also hear the criticism that House Bill 4015 will result in a cost shift and drive up premiums for all Michigan. This is a talking point that has been raised in every state that has considered similar legislation. However, reports and fiscal analyses from other states project only a minimal, if any, increase in premiums. I've provided several examples in my written testimony, but wanted to draw your attention to 2. After the enactment of a $100 per month insulin copay cap in the state of Washington, the state's Office of the Insurance Commissioner reported that 15 health insurers filed an average proposed rate decrease of 1.79% for the 2021 individual health insurance market. Washington has also enacted legislation to reduce its copay cap from $100 to $35. My final example is from Minnesota, where an analysis was conducted of legislation that proposed to limit patient cost sharing for drugs and supplies related to diabetes, asthma, and allergies that require the use of EpiPens. The analysis concluded that the net per person per month effect of the cost sharing limit would be just 2 cents in year 1 and would increase to 3 cents in year 10 of the projected period. The objective of House Bill 4015 is to provide affordability relief for the person with diabetes who uses insulin. By keeping insulin affordable, we can help keep people with diabetes out of the ER and the hospital and away from expensive and potentially disabling or deadly complications. With this bill, you have the opportunity to impact the lives of many thousands of Michiganders who rely on insulin to live, many of whom are your constituents, and you can do this in an extraordinarily positive manner. The American Diabetes Association believes that no individual in need of life-saving medications should ever go without due to prohibitive costs or accessibility issues. It's time. Michigan should be the next state to enact a limit on patient cost sharing for insulin. The American Diabetes Association supports House Bill 4015, and we urge you to vote yes. Thank you, and I will do my best to answer any questions you might have.
Thank you so much, Representative Conlin and Mr. Doherty, for your testimony. Members, do you have any questions? Representative Rogers.
Thank you, Chair. Could someone talk about the scope of the problem in Michigan and maybe some of the escalating factors that happen when diabetes goes untreated or when people are not able to afford their insulin? Like, can you play out the picture for us of what happens?
I can jump in here, and I don't have the numbers off the top of my head, but diabetes is one of the most prevalent diseases across the country. And if unchecked, if untreated, the comorbidities that are associated with diabetes are many. There's heart disease, stroke, any number of other diseases that can result from untreated and unmanaged diabetes. So I think in order to prevent diabetes and manage diabetes in those who already have it, it will help to reduce additional complications and associated healthcare costs related to it.
Thank you. I just, in my own practice of physical therapy, have seen a number of escalations, including amputation too. So I think we need to look at all available options before us to mitigate the costs, because we can't not afford to do just nothing. Thank you so much for your testimony.
Thank you, Rep. Rogers. Anyone else? Comments or questions? Rep. Bruck.
Thank you, Madam Chair. Question, do you know what is the average cost currently? So we're placing the cap at, you said $35 for the or $50, sorry. But what is the average cost right now that someone pays for insulin if they have insurance? I mean, is this just put into their annual deductible until they pay it and then it's covered? That's kind of my question.
I would respond by saying that it really depends on the person's health plan as to what's covered and the extent that it's covered. I can't really say what an average amount is. I can tell you that we are contacted by people almost on a daily basis asking what can be done to lower the cost of their insulin as they try to balance that cost with their rent or mortgage cost, their food and utility cost. It's clear that the financial impact on people with diabetes is tremendous, and House Bill 4015 will go a long way toward helping to make insulin more affordable.
I also read that I think the medical costs for people with diabetes is twice of what it is for normal people.
Overall medical costs. Okay, and I do have
Yes,
a follow-up
please,
question.
Rob.
I don't know how they passed it. It was regards to just kids with type 1 diabetes. I want to say it was last year, 2023. This deals with both type 1 and type 2, is correct? This particular bill? It doesn't distinguish between the two?
That's a good question.
That's correct. It would apply to anybody using insulin. And as I mentioned, everybody with type 1 requires insulin, and about 30% of people with type 2 require insulin.
Thank you.
Thank you. Any additional questions? Rep. Scott?
Thank you. Thank you for the testimony, and thank you for bringing about this bill. I do know there was a point in time that people were going over to Canada to try to get insulin because of the increased cost of this. So I really thank you for bringing forth this legislation. Very important. Thank you.
Thank you. Anyone else? Okay, well, I do want to make a comment as well, because diabetes disproportionately affect people who are impoverished, and the African American community suffers from high rates of diabetes. Some of the things that were mentioned about comorbidities like amputations and just the normal things you hear about diabetes, you don't think about the other things like loss of your teeth or loss of your sight. You know, these are all associated with unchecked diabetes. So this is very good language to affect people who are impoverished, where they have to choose between their medications and food. So this is just my comments on it as well. So seeing any other additional comments or questions from the committee, I'd like to thank you, Rep. Conlin and Mr. Doherty, for your testimony today.
Thank you, Madam Chair.
Thank you.
Okay, we're at the end of the meeting, so we need a motion to excuse Representative Bazat from today's meeting. Oh, Representative Harris moved to excuse Representative Bazat from today's meeting. Hearing no objections, Representative Bazat is excused. So, seeing no further business before this committee, we need a motion to adjourn. Oh, Rep. Nair just said, okay. Well, you had your paper going up now. Rep. Nair moves to adjourn, and hearing no objections, this committee meeting is adjourned.